I am Dr. Prashant Kumar. We are having a war against corona. There is no treatment which is effective against corona, and there is no vaccine which is available against corona. But yes, the symptoms of corona is very similar to influenza, common flu. The symptoms of corona and influenza are sharing, such as fever, sore throat, coryza, runny nose, breathlessness and abdominal pain. Whereas in corona, symptoms of breathlessness and abdominal pain is more in common compared to influenza. The other symptoms are similar to influenza as in corona. So this sharing symptom is creating lots of confusion, and many people are going to laboratory to get tested for COVID-19 whereas they are affected with influenza. And we have a vaccine available against influenza. It was declared that there is no vaccine for COVID-19 and influenza vaccine is not effective against COVID-19. This has further reduced the utilization rate of influenza vaccine. People are not getting vaccinated for influenza vaccine now because they think that COVID-19 is in current scenario and influenza vaccine is not effective against COVID-19, so they are not getting vaccinated for influenza vaccine, influenza also. This is not a good situation as a society and as a healthcare advisor for all of us. If more and more cases of influenza go to the laboratory to get tested for COVID-19, the utilization rate of COVID-19 kit will go up and there will be a scarcity of COVID-19 kit. The cost is also very high. It costs 4,500 rupees, whereas quadrivalent influenza vaccine costs 1,700 rupees. If more and more people get vaccinated for influenza vaccine, then the number of influenza cases will go down and the remaining cases which will go to the laboratory, the chances of having COVID-19 positive in them will be higher and misutilization or wastage of the COVID-19 kit will be lower. Whereas when they get vaccinated for influenza, they also get immunization of the influenza disease also. Whereas when they tested for COVID-19, there is no advantage for immunization against the influenza. Therefore, it is a very common advice, and I think it is very logical that as much as possible people should get vaccinated against influenza. Influenza vaccine is available in two varieties, trivalent and quadrivalent. The quadrivalent influenza vaccine has H1N1 H3N3 and two varieties of Influenza B, whereas trivalent has 3 strains of influenza. So it is advisable that more and more people get vaccinated for quadrivalent influenza vaccine, and this will also help in fighting against COVID-19. I am sure my message is clear. Thanks for watching.